Hello, my name is Jay Bryanus. I'm the Executive Director here at the Holyoke Health Center. I want to welcome you to our facilities, and I trust that the wonderful staff that we have here will help you on your journey towards the best possible health for you and for your family. Healthcare is a right. We believe that everybody is entitled to good health care, and we here at the Holyoke Health Center and our Chicopee Health Center will do everything we can to make sure you get the care in this, your healthcare home, and that you and your family feel confident and comfortable that you're getting everything you need to make you as healthy as possible. We've been doing this now for almost 40 years, and we now have a wonderful facility in Chicopee as well as our main office here in Holyoke. And in that 40-year period, we've learned a lot about you, our patients, the community that we're in, and how to best provide services to you. We hope what we have here will be helpful to you, will be convenient for you, and that you will get the confidence and the assurances that you need that you're getting the best care possible. You will be hearing from a lot of our staff who provide medical care, dental care, nutrition services, and a wide range of support services that we all have come to agree on as essential pieces of the caring system that many of our patients really need in order to become as healthy as they can be. Our staff are incredibly well trained. They are wonderful people. They care about this community. They want to understand what your needs are, and they really will do whatever they can do to make the system work for you. The healthcare system is very complicated, and every year it seems to get more and more complicated. And so part of our job is to take some of those complications and make them easier for you. But if you feel you're lost in the system and you don't understand it and you're not sure what you're supposed to do, make sure you ask our staff. That's their job, to help you understand the system. As we make referrals to other healthcare providers outside of our building, you may have questions about where you're going, why you're going, what to expect. Make sure you ask us. We don't want you to go someplace without understanding why you're going there. We want you to go there and get the most out of those visits. Most of the time, we'll see you right here in our own offices. And we've specifically developed programs that we can provide for you right here in our Holyoke and Chicopee offices, because we don't think you want to travel a lot. We think you should stay right here. In that sense, we want to be your healthcare home. And by healthcare home, we really mean that you should trust us to take care of you and your family's needs. We are your guides, we are your support, and we are the professionals that will make sure that all of your healthcare needs are well understood and that you're going to get the most out of your visit to the health center. Our pharmacy services have been added specifically so that we can continue to provide, beyond the doctor's exam room visit, the ongoing support and resources that you need by way of your medications. We will explain how you should take your medications. We will work with you if you don't understand how to take those medications, and we'll try to make it as simple as possible. Sometimes financing health care is a problem. We have a variety of programs here at the Health Center that will make it possible for you to get the care that you need in a way that's affordable for you. If you can't afford the care, we have counselors that you need to speak to, and their job is to help you get the care you need in a manner that you can afford. We're willing to work with you in any way possible, and we know about a wide variety of programs that we can enroll you in so that the cost of health care will not become an additional burden to you or your family.
Well, my name is James Fritz. I'm a program manager here at Holyoke Health Center. I manage quite a few programs and the grants that go along with those programs to support them. One being an adolescent program. Two of those grants come through the Girls Inc. Organization, and they're funded by BSAS, the Bureau of Substance Abuse, and the other one's funded by the YES Initiative, both coming through to support our Peer Health Advisory Board. Our Peer Health Advisory Board here at the Health Center gives us feedback about how to structure services and structure intakes to services so that it's more accessible to adolescents. Adolescents function on several different levels as peer educators once they've gone through the BART program, which is an 8-week program, teaching them how to become a responsible teen. After they've gone through the BART program and graduated, they get to go out and educate the community about everything and all sorts of things that they learn here at the health center, namely smoking, substance abuse, how to not succumb to underage drinking, how to avoid that peer sort of pressure, avoiding violence. We recently just published what's called a photonovela focused on Juan and the 3 bullies, and it talks about adolescents, and if they come across bullying or they're involved in bullying or they see bullying, that they can come to the health center, and it's important just to talk about it, to tell people, and there's linkages here that can get people help, specifically adolescents, for bullying. So that photonovela is out in the community, letting people know that we're a service that has multi-facets, and we're here to serve the community. Next, we have the smoking cessation program, in which I'm a smoking cessation counselor. I see patients on Fridays between 9 and noon for right now, and that schedule is hopefully going to expand. The smoking cessation program provides direct one-on-one support as well as group-level support through Hilda Rosario around smoking. We also refer patients back to their primary care physicians to see if they're able to take Chantix or use patches or use gums in support of that venture of quitting smoking, and it is a venture. So we're here in several different capacities to support our community. Our HIV support program is very confidential in the way it functions. For HIV positive people who get services here at the health center, we provide case management services, helping people to find housing, providing some financial support in obtaining housing, and keeping them from initially becoming homeless most of the time. HIV case management services include referrals back to their primary care provider. What's good about the health center is that not only does it have a lot of facets to it, but all the facets are connected. Someone who's coming for 3 particular services, for instance, dental, their HIV care, and maybe some follow-up screening, can get it all in one roof. So they're apt to actually go to and make it to all those appointments rather than run all the way across town to get my dental here, my HIV taken care of here, STDs and other screenings taken care of at another point. So that's a strength of Holyoke Health Center, and that's why it's a nice place to work.